Welcome back to News 4 Great Day. So you say you have sleep apnea. Are you using the CPAP machine? Well, you have our sympathy because a lot of people just don't like them. They're messy, they're loud, and they can, if you're claustrophobic, they can be a real problem. Well, there's a chance you may not have to use that CPAP machine. Joining us now is Dr. Anna Smith of Dentistry with TLC, and we thank you for joining us again. It's always good to see you.
You too, Ken.
I never like to take anything for granted with our viewers that may not know exactly what sleep apnea is, because as you've told us many times in the past, some people have sleep apnea and they don't even realize it, right? So what is sleep apnea?
A lot of people know they snore or have been told they snore. They may not believe it, but have been told that they snore. And that's typically a precursor to sleep apnea. If you snore, for many people, that will eventually turn into sleep apnea. It's when your tongue falls back in your throat and it basically shuts off your airway and you're not getting oxygen at times during the night.
If you have a light case of it, you may not even realize it, except for the fact that you're not getting enough sleep, and you don't understand why, because you've been in bed for 7, 8, 9 hours, and yet you're still tired during the day, and there's other bad things that can happen when you don't treat it, right?
That's true. A lot of these bad things we just kind of dismiss and think that they're normal from aging. For example, a lot of people with sleep apnea will say that they're not sleeping as long as they used to, or their sleep isn't as restorative as it used to be. A lot of folks will gain weight easily. Some people become depressed. Some people develop high blood pressure. Some people have other symptoms, and they're very easy to dismiss. I've seen thousands of patients come back to me, though, after they've treated their sleep apnea and say, my blood pressure is lower. I've lost 20 pounds without trying. I'm off of my depression medication. So a lot of good things can come from treating the source of the problem.
And we've talked about some of the low-end problems. There are some high-end problems, too. I mean, this can even be, in the extreme, can be fatal. What are the treatments? We know about the CPAP machine that you're sitting next to, which is big and bulky and ancient-looking, but you have a treatment that's much more modernized.
I do. For folks that don't like this or won't use it or can't use it, there's a different option now. We can make folks a sleep appliance. It basically is 2 pieces of plastic. They're custom made to fit over only your teeth. And it's easy, it's comfortable, there's no air pressure, there's nothing on your face. You can sleep in any position. You can travel with this and nobody cares that you have it on an airplane. You can actually wear it on an airplane so you're not snoring and annoying the people around you. This is the oral sleep appliance. And you mentioned that sometimes sleep apnea can be deadly. That is true. It's one of the major reasons that folks have strokes in the middle of the night or early in the morning. But with either the CPAP or the sleep appliance, those odds are drastically decreased by treating your sleep apnea.
All right. Well, thank you, doctor. Always good to see you. And I know you've helped a lot of people in the past. For more information, please attend one of the following seminars. Dr. Smith will be at the Hampton Inn in Litchfield, Illinois tonight, at Limelight's events in Ellisville, Missouri tomorrow, and at Comfort Inn and Suites in Greenville, Illinois on Thursday. All seminars begin at 6:30 in the evening. Dr. Smith provides more ProSomnus sleep appliances than any dentist in the U.S. And right now, she is offering $1,000 off the cost of a sleep appliance through the end of May. To schedule a consultation with Dr. Smith, call 618-466-9263 or visit cpapsucks.com.